It's really interesting that that let it rip attitude right now is something that I don't support. Many of my colleagues don't support. We know for other infectious diseases we would never say let it rip. And this is what we're hearing in many different
Yeah.
countries right now from politicians. If people don't adhere to getting vaccinated, don't adhere to getting boosted. Again, it doesn't increase those levels of population immunity. You don't bring in the basic, really easy, low-cost, fundamental ways of protecting yourself and others from getting infected. Then we're not going to reach endemic situation. We're going to have again, still increased numbers down at that local level, like William mentioned, and we're going to see more hospitalizations, more deaths. And I want to be really, really clear. On the current course that I'm seeing the politicians take us and the way that some of the population is dealing with this COVID-19 disease and virus right now, it's going to continue to take us on that pathway of new variants. Some of those variants won't affect us. Our immunity will be able to protect us, but there could be another variant out there. We had Delta, and we thought Delta was it. We thought Delta was going to end the pandemic. Then we went to Omicron. We don't know what comes next. And at the moment, this reckless political jargon and decisions we're saying at the moment is going to take us down a pathway of disaster.
I think in the UK at the moment, actually, it's a reaction and an appropriate one to changing circumstances. We've got falling caseload of virus. We've got a very highly vaccinated population. Our data show 96% of our population have got antibodies against the coronavirus. We're not going to get much better than that by continuing to flog the message of vaccines. We know that there will always be a few people who are a bit resistant to wanting to get vaccinated, but we've done very, very well. So therefore, one argument is, well, if not now, when? When will we be adequately prepared to reopen up our country? And so that's really why they are withdrawing from many of these restrictions, because actually the evidence is that they are not actually saving any lives anymore, because we're not translating those cases into consequences in hospital. This is, in our vaccinated population, a much milder illness.